Maria Holder Diabetes Center.
Eye exams, kidney checks, foot exams, these are all part of whole person diabetes care.
Starting up right now, it's time for 15 diabetic friendly minutes on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation, a special pre-Mother's Day edition.
So what's happening in this pre-Mother Day show? So I'm actually going to talk about a topic that is more related to women, but men you probably won't be able to relate as well.
The inimitable Dr. D,
That's Dr. Diane Bradford.
deals with a topic that is especially related to women and moms. Especially, tomorrow is Mother's Day.
You said that already.
Also, you get a chance to win a ticket to the Diabetes and Hypertension Association of Barbados Live Stronger, Longer Blue Wellness Conference, which happens on May the 18th and 19th.
I'd like to win that for my mommy.
All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that is there for moms and dads and all Barbadians. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A happy Saturday morning, VOBers! Peter Boyce here with this special pre-Mother's Day Diabetes show. Showing all the mommies that listening and reminding you that if you care about your mom, don't just be taking her to a fancy lunch tomorrow, but also make an appointment for a health check at the Maria Holder Diabetes Center located in Warren St. Michael behind Eunice Gibson Polyclinic. Anyone can go and get their health checks done there. So you can tell your mom, and while you are there, you can get your own health check done too. So it's especially for diabetics and pre-diabetics, but not only for diabetics and pre-diabetics.
The Maria Holder Diabetes Center.
But we are going to start out by giving you a chance to win. The Diabetes and Hypertension Association of Barbados will be holding its inaugural wellness conference, Live Stronger, Longer Blue Wellness, on May the 18th and 19th, 2026 at the Graduation Tents UWI Cave Hill campus. Come and hear from health specialists in their fields as they share valuable insights and practical tools to live longer and stronger. Tickets can be purchased directly from the Diabetes and Hypertension office located in Mount F Gardens, Barbados Hill, St. Michael, or on their website. But VOB listeners, here's your chance to win 2 tickets absolutely free. Here's how you can win. Log on to the Instagram page of the Barbados Diabetes Foundation to answer this question in the comments in the post related to this competition by May the 16th, and you can be a winner. You ready for the question?
I'm ready.
You sure you're ready?
I'm ready.
The question for you to win 2 tickets is, how often should you get your eyes screened?
I want to hear it again.
How often should you get your eyes screened? The first correct answer in the comments on Instagram wins, and the winner will be announced next week, Saturday the 16th, right here on VOB. I can hear people logging on to their devices now to answer that question. You already know regular eye screenings for diabetic retinopathy at the Maria Holder Diabetes Center is a must, so this should be an easy one for you.
Easy peasy.
So go on Instagram now to answer. Remember, you can book your eye screening by calling
243 3937.
Thank you, beautiful voice lady. And now it's time for another beautiful voice, Dr. Diane Brathwaite. And here she is.
Hello, good morning, and I want to wish you another happy Saturday. I hope that you had a peaceful and productive week. And this is Dr. B here, Barbados Diabetes Foundation. And of course, as you people out there know, what's coming up tomorrow is going to be Mother's Day. So I want to take the opportunity also to say Happy Mother's Day to all the wonderful ladies in Barbados who are mothering, the aunties, the grandmothers, the mothers like me, mothers of dogs, and more. Okay, so we want to celebrate you this weekend, and we also want you to celebrate yourself. Take a moment to pause, celebrate yourself, give back to yourself, and just love on yourself a little bit. And fellas, Alfonso, don't feel left out, but unfortunately this is the ladies' weekend, so I'm actually going to talk about a topic that is more related to women, but men you probably will be able to relate as well. So what I wanted to discuss today is an understanding of how diabetes can either be precipitated, changed, or impacted in a woman's life cycle. So first of all, there are various times in a woman's life where if she's living with diabetes, she may find her diabetes either changes or is more difficult to control or may require changes in medication, etc. And what are those phases? One can be during the actual just menstrual period. Another one is obviously if a lady becomes pregnant and she's living with diabetes, and then of course during the perimenopause to menopausal and postmenopausal period. So those are the three kind of time periods where you have to look out for changes, and if there are changes, maybe don't beat yourself up too much. It may be hormonally mediated. And I'm going to start with the first one. I'm going to be very brief around all the phases. So if you are living with diabetes and you're having menstrual cycles, and we even see this in young girls, teens living with type 1 diabetes, you may find that the blood sugar starts to spike just before the period. And in some cases, some ladies know they either have to modify their medication. If you're type 1 and you're taking insulin, you might need slightly higher doses during that time period. Or if you are on tablets, you may have to decide actually maybe you modify things like how you're eating during that period if you find your blood sugar goes up then. If you are experiencing excessive pain during the period, make sure you control the pain as best as possible with the help of your doctor, because things like pain, inadequate sleep, being sick, and excessive stress will also raise the blood sugars as well. Sometimes I see young ladies and they're not sure why their blood sugars are jumping around their cycles. It is related to the hormones basically. Okay, so that's number one. Number two, becoming pregnant. So I'm going to go to the person who is already diabetic who becomes pregnant. So two things. Number one, if you have diabetes and you want to become pregnant, you want to plan that pregnancy. You want to make sure you're going into that pregnancy with very good blood sugars. You want to make sure that you're taking folate at least 3 months prior to that pregnancy in the right dose to reduce the risk of side effects. Okay, if you have hypertension, you want to excellently control. So you want to go into pregnancy in a kind of good way. Okay, so you give two things. Number one, your baby the best chance of great health and an uncomplicated pregnancy, and of course yourself an uncomplicated pregnancy. If you are not diabetic but you are at risk of diabetes because you have a family history of diabetes, there is something called gestational diabetes, and that can occur therefore in pregnancy. And likewise, similar rules apply. Make sure you're taking care of yourself before you get pregnant, whether you are diabetic or not. Make sure you're going into a pregnancy healthy so your body is able to support a healthy pregnancy. And of course, consult with your doctors as early as possible so that medications that might not be safe in pregnancy can be stopped. Medications that are safe in pregnancy are the only one used. And of course, you're going to review your lifestyle and your diet, because remember, as I say, diet is everything. That is your number one pill, is how you eat and how you treat your body and how you rest and exercise. That impacts your blood sugar greatly, and then medication where needed comes on top of it. If you have had gestational diabetes, your diabetes might go away after pregnancy, but remember, your risk of diabetes is higher, and therefore screening for diabetes after gestational diabetes is very important. Yes, you may have it at your postnatal visit, but screening beyond your postnatal visit is needed on a regular basis, and your healthcare provider can help you identify a regimen or how frequently you'll get screened. Remember, mummies, if you've had gestational diabetes or you had diabetes in pregnancy, the risk of your child becoming diabetic in adolescence is actually higher, and your child will need screening early in the adolescent phase. Once again, get directives from your healthcare providers as to when their screening may be needed, but it can range from anywhere from 10 to 12 years of age. I find a lot of mummies who may have been in this position do not know this, and that's important to know. And of course, you want to make sure that you keep your children healthy to minimize their risk of developing diabetes in childhood. So once again, happy Mother's Day to everybody out there, all the mothers and the mothering mothers.
Thank you, Dr. D. We look forward to hearing the conclusion to your presentation next week as we go into our Saturday Song of the Day, dedicated to all mothers for Mother's Day tomorrow, including mine, Collie Boyce, and all the mothers at the Diabetes Foundation. This is the late Jimmy Cliff with Dear Mother. Compliments the Maria Holder Diabetes Center and Republic Bank.
Do you have a dear mother? Kinda devoted and true.
The Maria Holder Diabetes Center.
Dear mother, I'm sending to you best wishes and all the day through. May your days be cloudless and clear, bringing to you true happiness each day and night of the year.
Happy Mother's Day to everybody out there.
She's my mother, and I love her so, more than any other. Anywhere I go.
Happy Mother's Day to everybody out there.
Do you have a dear mother? Kind of devoted and true. Dear mother, may all that despair come to you right through the year. While I was a child, you were my God. You were always dear to me and always were by my side.
The Maria Holder Diabetes Center.
She's my mother.
Just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done, both me and my fiance, and I can say that I was well satisfied with what they did with the result. Right now the cataract is under control. I would say yes, that is very good. It's very good for diabetic.
Cutting edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. But members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Happy Mother's Day to everybody out there.
The Maria Holder Diabetes Center.